In this part of the class, we're focusing on the differences between the real and the relative torque. Meaning, what I want is really to apply the torque in the wire and that's it, or what the torque the wire is going to apply to that specific situation. So this is what we are going to focus now. Understanding how to apply the real torque and how to see if that real torque is really giving to us what we want. So let's do it. The real and relative torque. Knowledge of real and relative torque is essential to obtain maximum control in orthodynamic mechanics. Why is that? Because when I know how to apply and how to assess the real torque, I can manage to achieve what I want in relation to inclination of both anterior and posterior teeth, or even individual torque. Meaning, when I do the inclination, the torsion of the wire, when I apply the torsion in the wire, I will have the opportunity to see what that type of torsion is going to apply to the real life, to the teeth, meaning the inclination of anterior going buccal or going palatal. I can do everything when I apply the torque. The real torque is applied in the wire, and the way to assess, to understand, to evaluate the real torque is with the plier, grabbing the wire with the pliers and seeing in which position the other tip of the wire is passing in relation to the center of the pliers. So if I'm having no torsion in that situation, I expect that when I grab the anterior or posterior segment of the wire, now I'm trying to show just the anterior segment. What we see here is like an arch wire being cut in the middle, so we can assess the relationship between the cross section of the wire and the glass slab. Here is the glass slab, and here is the cross section of the wire. So it's not possible, it's difficult for us to see this, but if I looked at this situation here, in a neutral torque, no torsion in the wire, I would have the cross section of the arch wire completely flat in relation to the glass slab, parallel to the glass slab. No torsion means for us to neutral torque. So there is no twist on the wire. The base of the wire is parallel to the glass slab. But it's difficult for us to see something like this. That's why we apply in a clinical case this way of seeing. I grab the wire with the pliers, and I will try to see this relation. The center of the pliers, like this, the long axis of the wire, and the center of the pliers. This is a line. It's not angulated here for upwards or downwards. It's completely parallel to this part. So I have no twisting here. And when I apply a neutral torque, does it mean that I'm gonna give to the anterior upper teeth, for example, which is the example that is drawn here? Does it mean that when I have a neutral torque, I'm applying a passive torque to anterior teeth? Look at this, how important it is. Because if you think that this is the true, every time you apply no torque, you grab your wire from your stock and you insert in the slot of anterior teeth, you are expecting to have no torsion, no inclination. And sometimes it is true. Actually, in average, it is true, because anterior teeth, they will be inclinated, they will be flared in a certain position that in average will allow us to insert the wire without changing it. But there are the extreme position of anterior teeth that we need to manage, and it's not that uncommon. We see that very frequently when we have extreme inclination of upper anterior teeth. For example, when I have a periodontally compromised patient, these anterior teeth are flared, buccally flared, and this is not the same relationship between the wire and the slot when I have a situation like this. So a neutral torque in that situation will not keep anterior teeth in position. And it's very important because the torque is going to apply a certain movement that we don't want in the majority of the cases. In most of the cases, we need to avoid this type of movement of anterior teeth. and I'm going to show you why during this class. Neutral torque is this. So sometimes when we have the good position of anterior teeth and we don't apply torque, real torque, to anterior segment, we will keep the position of anterior teeth. We are not going to change the position of anterior teeth. This is what I mean. But this is not true in all situations. Let's do it again when we relate this to the relative torque. Negative torque, it means that when I apply a certain torsion, again, in relation to the anterior segment, because this is what we are focusing now. When we apply a certain torsion to the anterior segment of the wire, we expect to have a negative inclination of those anterior teeth that we are trying to change. And this is what we call a negative torque. And let's think about the upper anterior teeth, because this is related to the upper anterior teeth. I'm going to show to you that for lower anterior teeth may be different. And this is different. And the negative torque, it's called a negative torque because of this. If I have a well-positioned set of teeth, or I want to change when I apply a negative real torque, I'm giving a moment of the couple in anterior segment that is going to change the anterior segment inclination towards a negative inclination. And this is why we call a negative real torque. But remember, this is for the upper anterior teeth. So there is an angle between the glass slab and the base of the wire towards the center of the arch. Again, this is the way to see when we flatten the wire and we position it over the glass slab. This is something that we could see. Of course, it is not simple, but if we applied like a magnifying glass, we could see something like this with this angle towards the center of the wire. Remember, this is showing a wire, an arch wire cut in the middle, in the center of incisors. And when I grab the wire with the pliers, I expect that the posterior segment goes down. The posterior segment goes down because when it goes up, it's going to apply a negative torque to anterior upper segment. And let's see what happens now when I apply this torque in a set of well-positioned anterior teeth. A group of anterior teeth that are well positioned in relation to the inclination. So when I insert this wire this way in the anterior segment, the tendency is that those anterior crowns, they are inclined towards a palatal inclination, okay? So we can do that if we want. I'm gonna show to you that in a clinical view, in a clinical way, we really don't do that very frequently. There are situations that we really want to do that, but in most of the cases we don't want to have this. And so we are applying a negative inclination to upper anterior teeth because of the real negative torque in this situation. But we need to be aware of this. It will depend always on the inclination of upper anterior teeth or lower anterior teeth if you're applying the torque in that area. But I'm giving you a spoiler here because this is something for the next class. Look at this. So for anterior segment, it's going to be a real negative torque. But what if we do the same thing, positioning, inserting the wire, the same torsion from the upper, no, I don't want the upper, I'm going to give to the lower arch. Is it the same thing? Is it a negative inclination? No, it is not. It is quite the opposite. In this case, I'm giving to anterior or lower teeth a positive torque. So for thinking about the real torque, we need to refer to the wire that we are applying this torque. Because for the upper arch is this way, is negative, and for the lower arch, the same torque is going to give a positive inclination. Of course, you know that if I want to give a negative inclination, I just need to put the wire upside down. I just need to invert the position that I'm inserting the wire. It's going to give the same torque. But if I keep the position and I just remove from the upper and insert in the lower, I'm giving opposite torques. Negative upper, positive lower. So this is something that always will depend on the inclination of the teeth and in which arch you are applying, you are inserting the torque in arch, okay? The torqued arch. Positive torque is the opposite, of course, and if I'm giving to the upper a negative torque and I'm inverting the position of the wire, I'm giving the positive torque. So there is an angle formed, you know, in the previous example it was towards the center. It's now going and in the anterior direction. So now we have a real positive torque. And again, this is positive for the upper arch because we know that when we insert this wire this way in the upper arch, it tends to give to upper anterior teeth a positive crown inclination and a negative root inclination. So root goes palatal while the crown, they go buccal. And this is a positive torque. And again, for the lower arch, it will be the opposite. It will be a negative a negative torque. So we need to understand in which position we are applying this torque. And here I'm going to show to you the way I apply the torque, and I will compare the way I apply with the real torsion in the anterior segment with another way to do this, which we see very frequently in YouTube or other medias. People applying the anterior torque thinking they are applying a good real torque, but in fact they are not applying a real torsion anterior segment. They are just twisting the wire between the anterior segment and posterior segment, but the anterior part of the wire keeps untorqued, no torsion in this anterior part. I'm going to show this to you with this experiment that I gave to my students like this. This is the way I apply the torsion. When I do this very delicate rotation of my wrist and going closer each time, closer with my two fingers that are supporting the movement, close to the pliers, I'm doing just little twisting of the wire in the anterior segment. When I do that, I'm applying really a torsion to anterior segment. So look at this. I'm going to stop it here so you can see. Let me go again to this example here. Look, what I'm really doing is like just a very delicate twisting of my wrist. Look at this. This is my wrist, my right wrist. And I'm doing small torsions, very delicate torsions of my wrist, while my two fingers of the left hand, look at this, they are just supporting the movement here. But what I'm really doing is grabbing the wire with my two fingers and twisting my wire with the rotation or the rolling of my wrist. So we're going this way. I'm going to do it again so you can see. Look at this. From one part, like from lateral, think about this strips here as the lateral incisor, central incisor, and canine. So we have 6 strips here that are showing this. Let's do it again. Look at this. We have a little twisting, rolling the wire, the wrist, and I'm going with my two fingers closer and closer to the pliers each time I do this type of movement. So I'm doing the torsion of anterior segment. And look at this. What we can see now is that the strips, they are angulating towards the center, meaning we have here what we call the wagon wheel effect. So we have a torsion in the cross section of this rectangular wire that has the shape of an arch in the anterior segment. So when I do this torsion in this arch, I'm giving to that part a torsion that goes, if I'm using the wagon wheel effect here, for each 4 millimeters or 4 degrees, of torque in the anterior segment, I'm giving to those anterior teeth 1 degree of angulation towards of the roots towards the center. So this is the way that I'm really applying the torque. But when I do that, the canines, they are in this anterior segment. So the canines, they are also being applied for them the negative torque. And I don't want that. How do I know this? Look at the strip. The strip of the canines in the tip of the last strip, let's say. This is the strip of the canine. They are going towards the center, you see? So I don't want that to happen, and I'm now neutralizing the torque. So now this is the way I apply the torque to neutralize posterior segment. I grab the wire with two pliers, in this case two tweed pliers, one close to the other, and I rotate, untwist the posterior segment to have the neutral torque in posterior segment. And now we see that we have really a torsion. And let me go again to this point here. Look at this. We have the canines, they are perpendicular to the horizontal plane, and the anterior segment is showing inclination of the roots towards the palatal side. So a negative inclination of the root, which means that we are giving a positive inclination of the crowns. And canines, zero angulation. They are completely perpendicular to the horizontal plane, perpendicular to the wire. So no inclination. And now we are applying the other way. So people think that they are doing this using this strategy here. With two pliers, I'm grabbing the anterior segment and rotating the anterior segment towards a positive inclination. But look at this. You are not really applying a torsion in anterior segment. You're just applying a twisting between anterior and posterior segment. What you are doing here is really applying the torsion, a negative torque to posterior segment. That's all. And go to the other side and do the same. So what is the tricky part here? When we grab the anterior segment with the pliers, and if we see this, we think that we really apply the torque, but it's not true because anterior segment must be flattened. So when we flatten the anterior segment, we see that we went back to the same position. We have no inclination of anterior strips, no inclination. We just gave an inclination, a negative inclination to the canine crown and positive inclination to their roots. And look at this, negative inclination in the posterior segment, and the anterior segment is completely flat, no torsion. So look at this, again, no torsion in the anterior segment. So this is not the right way to apply the torque, and this is why I really think it is important for you to understand this and to practice, of course. You need to practice so you can have complete confidence when you do that in your daily practice. Because if you don't practice this, let's think about one situation, clinical situation. You see the case, you know that for that case it must be applied a certain type of torque, but you are late in your schedule, and you see your computer with those faces saying, well, we have like 5 patients in the waiting room. What can I do now? No, I'm not doing the torque now. I will let the torque to be made in the next consultation, the next appointment. And this is not something that is fair to your patient, and you are going to delay your treatment. The finishing of your treatment will be delayed because you're doing that, and the next time your patient come back to the office, you may have the same 3 or 4 people waiting in the waiting room, and you think you don't have enough ability to do the torque very fast, so you do again the same thing, procrastinating and delaying the treatment. So you need to practice that so you can do this in like less than 1 minute. And it's completely possible. You do that in 10, 20 seconds maximum if you do that a lot. And this is what I always say. If you follow the 5,000 times rule, you are going to be good in what you do. You need to do something 5,000 times so you consider yourself moderately good in what you do. Some people say 10,000 times, but I think 5,000 may be enough, okay? So this is the torque. The posterior torque is the same. The posterior real torque, is going to be applied in the segment of the wire, but you need to pay attention in this point here. In the past, we usually did the progressive torque, the real torque in the lower segment, in the lower arch, because we didn't have uh, the programmed brackets, the totally programmed brackets like the straight wire brackets, which we know that they have embedded in their prescription the inclination, the angulation, the toe in, the toe out. But nowadays we don't use edgewise brackets, meaning non-programmed brackets anymore, or we use it little. We don't use that much, let's say. And in the past, we needed to do the progressive torque in posterior segment, but you don't need to do that anymore unless you're using edgewise applies, because the torque is already embedded in the wire. So if you do the progressive torque having a pre-programmed bracket, you're applying more torque in posterior segment, which already have this segment. It already has the inclination of the specific tooth embedded in the bracket, in the tube. So if you're doing this, you are adding more negative torque to that specific tooth and not to the other teeth. So you just need to apply the sectional torque, like what we are doing now. So the way to do the torque is this, to see the torque is this, the same. We grab the posterior segment with the pliers and we see in which position the other tip of the wire or the arch wire is passing in relation to the center of the pliers. So in this case here, we have what we call a positive torque to the upper or negative torque to the lower. So we're gonna see that in a few slides ahead, but this is the way we see. So when we apply the posterior torque, the posterior segment of the other tip of the wire, it needs to pass not in the center of the wire, of the pliers, but it has an angulation in relation to the center of the pliers towards up or down, and this is what we call the real posterior torque. We can even assess the magnitude of the torque in relation to the center of the pliers. Of course, this is not that precise, but we have like a trained eye to do that. We can know that we have like a approximation of what we see in relation to the center. In this case, something around 30 degrees of inclination of like the angle in relation to the center. And this is really a good torque for the lower, but maybe excessive torque for the upper sometimes. But again, it will need to be measured in a relative environment that we're going to refer in the next class. Look at this. I'm applying the torque, and this is the right way to see to assess the torque, because it's not just about the real torque. The real torque may mean nothing for me. If we apply the torque and we don't achieve what we want for that specific group of teeth, it doesn't make a point, because we are not giving to giving to the teeth what we want. So sometimes we apply the real torque and we don't have what we want, or we have the opposite in relation to what we want. I'm going to prove that to you. Let's move on. This is a neutral torque. You see, we have no torsion in posterior segment, and sometimes this neutral torsion, it will mean no torque, no relative torque in that posterior teeth. When I insert the wire inside the tube, I have no couple. How does it happen? If I have well-positioned posterior teeth in relation to the inclination, and the inclination of posterior teeth is what is embedded in the tube, neutral torque won't change that position. Why is that? Because the inclination of those teeth are good, and the tube now, because we have a pre-programmed bracket, the tube now, it has the slot parallel to the horizontal line. And the horizontal line in the neutral torque is parallel to the cross-section of the wire. So it will match the inclination of the wire, will find the exact inclination of the posterior teeth slots. In this way, in this environment, it won't change the inclination. So in this case, neutral torque will represent to posterior segment no torsion. no relative torque, what we call a passive torque. This is another spoiler, because we're going to refer to this torque in the next class. Here it is. So this is the way we apply the torque with two pliers, twisting the posterior segment. The anterior segment is going to be just the just to support the torsion of posterior segment. So we have the plier to support and the plier to do the torsion. So we have those two pliers giving this torsion in the posterior segment. And at all times we must adjust, okay? We must flatten the glass, the wire in the glass slab, because we don't want vertical displacement of the teeth, because we have already leveled and aligned the teeth, and we don't want that vertical displacement of the wire. That's why we need to do that at all times. We need to do the flattening of the wire in the glass slab and checking the glass slab. And here it is, torsion. Let me show it to you again. So I apply the torque in posterior segment, and what I see now is this, the torsion of the wire and the angulation of the cross section of the wire in relation to the horizontal reference. In this case, we call it what? What do you think? What is this type of real torque? What we call this type of real torque? This is a positive or negative real torque to the lower arch. What do you think? Huh? What does this torque do to the inclination of posterior teeth crowns? Is it going to change, first of all, change the inclination? Yes, it's going to change, because it's generating a couple, and this couple is generating a moment that will change the inclination of posterior teeth towards buccal. The crowns are going buccal and the roots are going lingual. Look at that. So this is the way we use to assess what we call the relative torque. Here it is. It goes down this way. So when I go up to insert in inside the tube, this side here will be torqued, and the torsion that we gave here will apply a couple. Let's see this couple. So this is the way we assess the torque, and when we do that, we consider this a positive real torque to the posterior segment. And the relative torque will be what? I'm referring to the relative torque because this is important for you to understand now this relationship. I'm going to come back to this point in the next class, but here is important for us to see. Same thing is going to happen in the other side. And then when we apply the torque, in just one side, we have a different way to see that. I'm not focusing on this now, but I'm going to show to you that sometimes we look at this and think, well, there are vertical components in the other side, but they're really not, because they are the same in this situation here. When we apply the same angulation and we have the same couple in both sides, the vertical components are going to be canceled. And we know that because this is what we call the truncated V. This is the V shape, or we call it the geometry number 6, in which the vertical components, they are canceled, okay? But what if I'm applying not the V shape here? I have just torqued one side. Am I really going to give to the other side a vertical force? I'm going to show to you, not now, but in other classes during this course, that this is not true. Because we can refer to this situation when we have just a two-couple system, but it's not the case here. We have a full engaged system here, in which we insert the wire inside all brackets. The entire system is restrained. So this is a little bit different. I'm going to show that to you, because this is a very common doubt that we see when we apply this. But again, I'm just philosophing here. This is the couple that is generated. So we have a force towards upwards and a force here downwards. This is what we call a couple, two forces in opposite sense, same direction, non-collinear, and we know the predominant force here. The predominant force is that one which is farther from the center of resistance. So this is what's going to happen. This is furthest from the center of resistance. So meaning this is going to give more moment than this one. And this is the sense of the couple. It goes this way. This is the sense of the couple. This is, in this view, a clockwise sense, meaning we go buccal with the crown and we go lingual with the root. And this is what's going to happen. But what if I'm applying the same torque here, real torque, and I'm inserting this wire this way in the upper arch? It's going to give the opposite direction of the moment, like this. So when I apply this torque and I'm putting the other tip of the wire inside the slot, the same way we do the measurement, we assess the real torque in the pliers, and when we go to the real thing, to the real environment, to a patient's mouth, and we check position in one side and we check the other side, we see something like this. We apply to that side, to this side here, we are applying a negative crown torque. Why is that? Because when I insert in the other tip, in the other tube, the other side of the wire, the tube, we are applying a couple that is generating a force, two forces. I mean, this is the couple, two moments, and the predominant moment is always the one that is in a higher and a farther position in relation to the center of resistance. So this is the force, meaning this is the predominant moment that is giving to the system here a palatal crown torque. You see this? A palatal or negative crown torque. So if I did the opposite, look at this. This would be the predominant moment, which is farthest now from the center of resistance. So now we have quite the opposite. We have the buccal crown torque, which is also a negative or a palatal root torque. Okay? This is the way we see things in orthodontics, and the importance here is to understand the relationship between what we are applying the wire, which is the real torque, and what is going to happen in the dental arch, which is the relative torque. Okay? This is the relative negative crown torque. So guys, this is what we wanted to show in this part of the class. What I really wanted to show to you in this part is this clinical aspect of the biomechanics with torque. We must at all times understand the relationship between the real and the relative torque. In the next class, I'm going to show to you the clinical way to see that. What we apply in the real torque and what we see in the mouth. This is what we're going to see. See you soon.